Me now with more is Dr. Colin Furness, infection control epidemiologist, to talk about the latest modeling that we just heard. Dr. Furness, what's your take on where the country is going in terms of cases?
It's obviously a little bit worrisome to see cases increasing. I don't think we're going to see gigantic growth. I don't think we have lockdowns coming at us. I think what we expected to see is happening, which is there are local explosions in Ontario. So there are, be it a religious group or a particular school or a community or a factory, we're seeing those kinds of things happen. They're concerning because they're happening more, and Delta is more virulent than its predecessor. So we're seeing that, but we're not seeing uncontrolled growth that would suggest that we need to do really drastic things. And so I think that's the upside.
Okay, that is good news. And the metric is really the hospital and the ICU numbers, is it not?
It is, and the news there is not as good in the sense that hospitalizations and ICU admissions always lag in increasing cases. The evidence is pretty clear. The decoupling that people expected to happen, that underpinned Alberta's very unsuccessful strategy, that doesn't exist with Delta. If we still had Alpha, or if we still had original COVID, then we might expect vaccination to produce a decoupling, so we have cases but not serious cases. With Delta, that's not happening, and so we can expect hospitalizations to rise. We can expect ICU to rise, and now is the time to be very clear that we need to pause reopening, and there's a few things that I would like to suggest we roll back, particularly full stadiums. Is
that right? So you believe that is a vector for transmission?
I don't see how it couldn't be. When you have that many people, and when we have a vaccine proof of vaccination certificate that is easy to forge with anyone who has access to Microsoft Office, we have a problem. A small restaurant could conceivably have a COVID positive person in it. A full stadium is absolutely going to have COVID positive people, and it's a statistical certainty by the time you get to a crowd that large. And we shouldn't be doing it. There's no question we shouldn't.
What about, and I'm just pushing back here, playing devil's advocate, what about the ventilation, though? For example, if you're talking about a hockey game, is there not good ventilation in that space, or are there just too many people?
I think if everyone were just sitting in the stands wearing a mask, sitting quietly, we might be okay. But I've been to too many stadium games to think that that's actually typical of the experience. I'm thinking about the jostling lineups to buy beer and hot dogs. I'm thinking about the queues and the crowding in bathrooms. It's congested. It's very congested. And so unfortunately, I don't think we can ventilate our way out of the dangers of a crowd that.
Okay, fair enough. But if that's not going to happen, can we look to the potential that we're only a few weeks away from the younger children now being vaccinated? How much of a game changer will that be?
Well, I think for anyone who has kids, psychologically, it's going to be a massive game changer. But we have to be clear, when COVID is circulating, vaccinated people can get sick, and they do get sick, much less than if they weren't vaccinated. So the vaccine works, but it's not perfect. So any country that has said, we're going to vaccinate our way out of this and we don't need to have restrictions, has failed. That has failed 100% of the time, and we shouldn't expect to be any different. So I don't think we need draconian measures, but we need to not be dumb. And full stadiums, frankly, is dumb. It's just not what we should be doing. Vaccinating kids will help, but it's not going to allow us to have full stadiums quite yet.
What other measures do you think need to be addressed?
The number one that I have is that we do air filtration where people are gathering indoors. And the number one on that list is restaurants. That is one of the most dangerous places to be right now because we're not doing anything to scrub air. There's no ventilation or filtration requirements. And you've got people laughing and eating and being together in close proximity. That's dangerous to me. Now, I think we absolutely need to acknowledge airborne transmission, and we need to put HEPA filters in restaurants. This is easy. This is very easy to do. It just takes political will.
So for people who want to be out and about, doctor, and need to take some personal responsibility here, would you say avoid going to restaurants or do some homework and find ones that are ventilated properly, or continue to eat outside in heated patios? I'm just trying to find, because people will want to find workarounds. So what's the best way to balance the two?
That's a very fair question. A very small number of restaurants, I think, are standing up and saying, we're going to accept responsibility for airborne. We're going to do it even if the province isn't, and are doing that. And I think that's absolutely fantastic. That's a restaurant I would consider going to. Apart from that, heated patios, sure, that's a better idea. Takeout even more so. I'm a big believer in supporting our restaurants, and my family orders a lot of takeout. And I think that's the way we're trying to have it both ways, is to be out there without being in there.
Be out there without being in there. Dr. Colin Furness, good to talk to you. Appreciate it as always.